Well, it's 8:01, so let's get rolling here. So welcome back to another edition of the New Dentist Show. This is, I think, episode 7. So I'm excited to have Dr. Rob Ritter on with us as our guest tonight and my unofficial official co-host, Bill Robbins. So welcome back, Bill, and thanks for coming on, Rob.
Oh, it's
Appreciate you
great to
being
be
here.
here with you. Thanks for having me, and it's always a pleasure to be able to spend some time with both young dentists, my friend over there, amigo Bill Robbins, the teacher's teacher, and then we get to talk about some really cool things, what the future holds, and just try to, I learned this a long time ago, just pass it on, what we've learned, what works, get rid of the stuff that doesn't, and keep sharing it.
Sure. I mean, that's really what this whole show is about, especially because I think young people gravitate towards people in the profession that have reached certain levels. And this is kind of a surreal moment for me because, like we said last week when we talked, 3 years ago, I was listening to a lot of Kirk Barron's Best Practices podcast. And through that, I really gravitated towards what you and your business partner, Chris Ramsey, were saying with your practice development and practice management. And it's something that when I was looking for a vision of who I wanted to become in my practice and personal life and all those different components, I looked right towards you. And, it was hard during this time, in those times of struggle. And like I said, when you had to fire somebody, I listened to your podcast several times to kind of get pumped up and saying, I deserve better. I need this. This is something that I know something good will come from this. And hearing that voice over and over and over again in my head really got me through. And on the other side of this, it's fun to see now us talking through a computer screen because you've had a tremendous impact on my career without even knowing each other. And I think that's the coolest part about a podcast is something that it's really the inspiration of this show is the fact that if you can extend through different channels and reach people on different heights, it's really what it is. So that's my introduction to you. I really don't know a whole lot about you besides your interviews and your podcast. So I'm excited to dive in, but I just wanted to express my level of gratitude towards what you've done for my career without even you knowing it. So thank you for everything you've done for me.
Really, that touches me. So, and in a way, that's kind of why we do this, so that even if I don't meet you in person, you can still glean some information and, make it better for yourself, make it better for your dental family, for your personal family. And it's a journey, not a destination. And some things work and some things don't. But I've always been a big believer that, you can always learn something from somebody most of the time.
Yeah.
And then just gravitate towards good people, find a good mentor like that guy over there. Sure. Who's a mentor of mine. I call him the teacher's teacher. I got to get the quote out right now. I'll never forget Bill. A couple of years ago, we were talking about somebody, I won't mention a name. And Bill said to me, he goes, it's great, but you can't be an expert in everything. And I take that, and Bill, I use it at almost every lecture. I quote you for that. Because you can't be an expert in everything. You can't be an expert in occlusion, practice management, adhesion, ceramics, implants, tissue. You just can't. You got to go to the people who are the experts and glean from them and take from them and then make it part of your own. So I've sought out people like a Bill Robbins, a John Coyce, a Frank Spear, a Dennis Tarnow, and I go to these people and I take from them what they're really, really good at, and I take it and implement it in our practice. And it seems to have worked. Nothing's perfect. It's a journey again, but it's been fun. I get to do some fun things with some fun people. And then I show up at great meetings, like when I see Bill at the Restorative Academy, and it's just like, it's one long conversation that gets broken up by 51 weeks, right, Bill? And then we just come together again at that 52nd week, and it's great. And they know that my friends, I'm out there for them. If they need anything from me, they always text me or ask me a question and vice versa. And that's great too. That's the great thing about technology right now. Besides these Zoom webinars or Facebook Lives or whatever, we can FaceTime each other. We can keep in contact with each other. And even through some dour times or things that don't look great in the short term, long term, they're going to be great. Somebody asked me today in the practice, they said, don't you think it's going to be bad in 2021? I said, I refuse to think that way. I refuse.
Yeah, sure.
I have to, for myself, I have to tell myself that next year is going to be better than this year. Mm-hmm. Otherwise, if you don't have that hope, I guess you would call it hope, then, how do you get up every day and think that you're going to get through tomorrow and then the week and the month? You have to think that this is going to end at some point and we're going to get back to something that we're going to enjoy and be able to be profitable at and be proud of. And if I just think that, oh, this is going to continue on for the next year and a half and there's no end in sight, that's just no way to go through life. So I believe it's going to be better for 2021, and no one can talk me out of that, at least not now.
It's a common theme. Kirk says it all the time. You always have to believe tomorrow's gonna be a better day, and if you don't, then you're only going downhill from there. And I think that's important, just to kind of keep having this infectiously positive optimism and move forward with that, or else what else is there to go forward with?
You're either bread or you're wine. You're either going stale or you're getting better with age, right?
I love that. Right. That's a good one.
You want to be bread or you want to be wine. So I prefer to be wine, and I like a good Bordeaux. Sure. And so, when I was younger, I probably liked the bread a little bit better, thinking I'd eat it before I got stuck. But now I'm more into wine. I think my palate has gotten through the years.
Awesome. Well, I think that's a profound statement right there too. But let's talk about your journey. So like I said, I don't really know a whole lot about you. So you went where to dental school, and what did you do after that?
Okay, so I'll make this part brief because it gets a little. I don't know. I don't like, the truth is I don't like talking about myself. I'd rather talk about our friends and funny things that happen along the way.
It's about you, Bowen.
I grew up in West Palm Beach, and so I went to the University of South Florida in Tampa, and then I went to the Medical University of South Carolina.
Sure. Graduated
from there, and I moved back down to Florida, and I've been practicing in my area for 25. I just started my 26th year.
Great.
And, it was a challenge. I'm not going to lie to people. It was a challenge for me. I went into an associateship and I bought the dentist out. And it was a challenge converting the type of practice that he had into the type of practice that we have now. And it was a challenge both from it was everything. It was the types of patients that were already in the practice that were used to basically patching, drill, fill, bill, silver, PFM.
Okay.
To more comprehensive, aesthetically based restorations.
Did you always have that vision of wanting to be aesthetically based right out of school?
100, right out of school.
Okay.
And I didn't, right out of school, I started taking CE, and right out of school. In fact, the quick story there, the side note is that I was 6 months out of dental school, and I took a course by Dr. Bill Strupp. Mm-hmm. And I call him Uncle Bill now. And I went into his office for a day before his 2-day course, and I saw this man prep restorations, how to do foundational core buildups, just exquisitely done dentistry. And I had a great interaction with Bill. And when I see him, I still hug him and call him Uncle Bill, and the guy's fantastic. And I knew I wanted to do quality restorative dentistry like Bill, right? And I didn't have the money to pay for his course. I had to put it on a credit card. I didn't have the money. But I did it because that was part of I said, I'm not going to, if you only set the bar at average, that's all you're ever going to be. And so I said, I don't want to be average. I want to be not just above average. I want to be excellent. There's no such thing as perfect. And then the last challenge was for me, local dentists were not very good to me when I moved to town because of my vision. I didn't want to be like everybody else. And I had some detractors and some people who slandered me and made my at the very beginning very difficult for me. And I just persevered. I didn't care what they said. I just kept doing it. So the dentists got turned off by me because they had heard some other things about me that probably weren't true, but you know how that works. Mm-hmm. So they met me and then they're like, oh, you're a pretty good guy. I'm like, well, consider the source of where it's coming from. And so I had to persevere through all of those different things to get to where I am now. And then I had a failed associateship. Then Chris became my associate for a couple of years before he moved into our practice. And we've been together now for 20 years because we have the same goal. We have the same philosophy. We did the training together. I did, but I'm 5 years older than Chris. And what's really funny about that I've gotten some crap about this through the times too, is if you take a look at what me and my business partner produce, we are literally at the end of the year within $2,000 of each other for production for the year. Okay. Now, a good friend of mine, Nelson Rigo, who is one of my lab ceramists, used to kid around and say, someone's cooking those books. But
yeah, right.
But I always got back to Nelly, and Bill knows Nelly well. I go, Nelson, you have to understand that me and Chris do exactly the same thing. It's not like I take out teeth and put implants in and Chris does, endo. We don't do any of that. We don't do any specialty work. So when you think about what we actually produce, it's incredibly similar on a given day. And so that part of the journey has been great. I've got a partner who's trained with me, who does, if something happened to me, God forbid, or vice versa, he can step in and finish the case, because we work with the same laboratories using the same materials. So that's been part of the journey. And then as far as, education, when I came out of school, I did Bill Strupp, and then I did the Dawson Academy courses and I finished them. Then I went ahead and I did all of Spears courses when Frank used to do the traveling courses and then have the course actually in the office that Greg Kinzer now owns. And then I became a mentor at Pack Live, where patients would bring their own patients and we'd show them how to do live patient veneer courses. And then I finished the COIS curriculum, and along the way I would take a course from, say, Bill and Jeff on the core philosophy, or I took a couple courses from Mark Piper on joint-based occlusion. Sure. And you add it all together, and I've come up with this sort of conglomerate approach to what I am able to look at things now differently than I did 20 years ago. And I think it's served us pretty well, because I can look back on my cases, and of course we can always change things, but a lot of my cases are in the mouth 20 plus years now, because there's a certain way of doing it sequentially in order. You want excellence every part of the step, because if you take a shortcut, it's going to blow up in your face. And it seems to have been working for us. So I'm pretty happy with that, but I'm still learning. I always tell people, I know about that much of dentistry, and I keep taking it all in, and then I keep passing it on to somebody else, and I keep learning because it's fun. I enjoy learning more than I ever did in dental school, that's for sure.
Oh, I think we all have. That's kind of the theme with every guest on here, is that dental school was just a struggle for most, and it's the people that took off really the ones that enjoyed after dental school and just the education that comes with that. But John Cranham talked about last week, he said, find a curriculum first, which is what you did with the academy. And then you started pulling different things and modalities and different ways from everything. So, I mean, that makes total sense to me, is that you got a solid foundation, and then you just kind of built on that with the things like Spear and Cois and all those different aspects. So I think that's a brilliant way that you obviously recommend. But is there anything that you would, is there anything different within all the different modalities that you would say that you would, if someone was interested in going one way or another, that you would recommend?
I don't really steer people that way. I always tell them, whatever it is, like John said, I'm sure, Bill feels the same way. You find something that's comfortable with a comfort level, that you interact with people, that you feel you have a shared pathway, that you feel like it's a good interaction between who's ever there. And remember, it's not the end. You see, that's the one thing, though, that I have noticed through my career, is that when you lock into only one of them and you only stay there, then I don't want to say you have blinders on, but sure, you only do it that one way. Now, if you have success doing that, that's okay. But I've never been that kind of a follower. I've always wanted to take a little bit from here and a little bit from there and a little bit from there and kind of make it my own. But I think starting anywhere and finishing that curriculum before you move on to something else is always good. And again, it's like you said, the key words are foundation. These are foundations, right, that you're going to be able to fall back upon. At the same conversation I had with somebody else, I had it with Scott Finley. Sure. And we talked about analog dentistry versus digital dentistry. And me and Scott were saying that me and Scott, he's a couple years older than me, but we came through analog dentistry first, like with Bill. And then along the way, I picked up digital dentistry, and I transitioned over to digital dentistry. But if digital dentistry failed, I could always go back to analog dentistry to bail me out. What I'm concerned with for younger dentists, if you go to a progressive dental school, like my dental school in Charleston right now, is so digitally acclimated, and it's incredible. I mean, it really is. But what happens when the digital systems fail? Do you have the analog background, the analog knowledge, the analog experience to bail you out of a situation that the digital is failing? That's my concern moving forward. Because I can talk to you about, we're going to talk about digital here in a little bit later, but that would be my concern. That's actually, though, again, part of the journey. I have to bring this up because Bill is here too. I got involved in a couple of different academies, one of them being the Restorative Academy, and one of them being the Aesthetic Academy. And you talk about going to these meetings and interacting with our legends, the people who we just, admire and listen to and take information from, and going to those meetings. And interesting, they're both 6 months apart, although we just lost the Aesthetic Academy for August because of COVID.
Right.
I would go twice a year to these academies, and I could hear the best lectures, and then in the breaks interact with these people who were speaking and say, hey, I do this. How are you getting your success? What can I do? And all of that sort of builds on each other as well. It's just constant input of quality information from quality people, right?
I think it's so important. That mentorship aspect of things, just picking people's brain is everything, right? I mean, so if you can lean on people and they can show you a different way or different technique or something, that's really the value. It's not the awesome presentation that was given. It was more the side banter on the side. I mean, I don't go to the bathrooms because I just like to talk to other people during those discussions, right? That's what it is. I'll hold it so I can.
Whenever you're like, hey, what's going on? But I got to mention that guy one more time. I mean,
absolutely.
I met Bill years ago. He came to our Florida Academy. I don't know how many years ago that was. And I just sat there, and the old Memorex commercials where the speaker is blasting and the guy's kind of getting blown away. And I said, oh my gosh, I've been looking for somebody like this for a very, very long time, because Bill has that way with the core that if you don't understand, to me, Bill is the gummy smile. And you want to learn the gummy smile, you learn core. And everybody else is kind of flailing around, and they take little bits and pieces and they call it their own, but it's not what Bill and what Jeff put together initially. And it changed the way I looked at cases. It's unbelievable. I was talking so me and my partner go out to lunch today. We were talking about a couple of different cases. We got some big cases undergoing. I said, do you realize the difference between us and the majority of dentists out of town is that when these people come to see us, we can look at things, excuse me, Bill, globally and say, okay, what they're asking to do and what the dentist proposed to do is not even close to the problem that they have, because they can't see globally what's going on in this patient. And so that's why me and Chris have no problem telling the patient, we need to do it this way, A, B, and C. We need ortho, we need perio, we need to do an arch of dentistry, whatever it is, whether it's phased, because the other dentists, they can't see it, they can't put it together. And the reason they can't put it together is they probably haven't taken Bill Robbins' core courses, right? Or they go somewhere else and they give them a snippet of it, but it's not the entire package. And so I'll implore everybody, I want them to take Bill's course or buy his book and learn the core system about how to diagnose this, because it changes the way when somebody comes in with a complex problem, how you tackle that case.
No doubt about that. I think the study club that Bill has on Fridays is...
This is awesome.
Oh, thank you. I mean, obviously this is nice, but this isn't about me. It's not supposed to be about me tonight. It's supposed to be about you. And I'm going to tell a story.
Talking about myself.
I know. I'm going to tell a quick story though. We and this is the advice. I'm going to give my one piece of advice tonight, even though it hadn't been asked for. And that is, when you have an opportunity to go and spend a day in another dentist's office, never pass it up. And you never get too old to go visit another dentist's office. I promise you, you're going to learn things every time you do it. And one of the very best days of me ever doing this was the day I got to spend with you and Chris. You remember it? I mean, it's been quite a number of years ago. And I came and I hung out with you guys and just followed you around all day and watched you do dentistry. And I mean, you dropped in 2 implant crowns. By the time I would have gotten my temporary off, they were already in. I'm thinking, holy cow, these people are amazing. Dressed in black, and everything's so cool. I mean, you got one of the coolest offices ever. And so here's my piece of advice. Take the opportunity, regardless of where you are in your career, even if you're an older guy, take the opportunity, go and spend some time in another dentist's office. I promise it will pay dividends for sure. It did for me with Chris and Rob.
Awesome. Excellent advice. It really is. Because you'll pick up things, not just, let's keep going, Bill. You won't pick up just how to seat an implant crown or how to scan. You'll notice how they're talking to patients in the front, how they're transitioning patients. Maybe you'll see a piece of paperwork of the work, the what do they call that? A routing slip. You'll find things along the way and you're like, hey, can I grab that? You mind if I use that? Because most people don't care. I mean, you don't practice down the street from me. Even if you did, I'd still give it to you. So I think that's excellent advice, Bill. And I enjoyed that. I totally remember that. And I had the biggest smile on my face having Bill, one of my mentors there in my practice with me.
What a cool opportunity.
Think about it for me. Here's Bill, who has helped me on my journey there in my practice. It was pretty awesome.
So let's dive into your practice, right? So you said it was a struggle early on, but I mean, were there certain things that you picked up or you did that you would say those were tipping points in my practice turnaround? Because you didn't go from where you are now and start from there. You did a lot of work.
It did. You just have to have a vision. I mean, it sounds superfluous when you say that. I can't stand, when rock stars say, "Oh, just got to make it happen." No, you have to have a lot of intestinal fortitude, and you have to take, I don't want to mention the person's name, but somebody said, when you stand out in front, you take arrows in the back. And just because you want to do it your way, and it's not what other dentists around your town are doing, it doesn't matter what they're doing. Do what you want to do and create your own culture in your practice, right? Because all of a sudden, it doesn't happen overnight, but 2, 3, 5 years later, you have that reputation in town. My orthodontist came by today, and he came to the office, and it was his day off, but I actually pulled him in a room for a big case that we got to work on. One of the toughest cases I'm probably ever going to challenge myself. I'm probably going to share the pictures with you, Bill, at some point. This is going to be the toughest case I probably have ever tackled in my career. And this patient went to go see another dentist. And as he's talking to her, he's looking at the case with me. And this patient's going to need ortho, she's going to need perio, she's going to lose her front 4 teeth with a high lip patient. This is on a 36-year-old nurse. It's going to be one of the most challenging cases I've ever done. And the orthodontist said, "How did you find your way here?" And she goes, "Oh, well, Dr. Ritter is working on a friend of mine." He goes, "Well, I'm not surprised. They probably have the best reputation in town." He goes, "But I'm going to tell you, you don't know how lucky you are to wind up here, because if somebody else would have taken this case, this could have been a catastrophe." I mean, really bad. So all of a sudden, I'm sitting there thinking, wow, I don't even know. You kind of get locked into your office, right? You don't really know what goes on outside of what's said about it. But there's my orthodontist telling this patient, "Wow, you're in the right hands for this type of case, and it's going to be difficult, but we're going to get there." And that made me feel good. So my practice, the way we do things, I'm not going to say it's for everybody. I mean, there are things that me and my partner say to patients that make people cringe. They do. Because we're incredibly focused. We're extremely straightforward with people. We don't candy coat it. I don't get down on one knee and hold their hand and tell them I'm going to be there for them every step of the way and they're going to be okay. We tell them how it is. We got their back. We will warranty it. We have the care, the skill, the knowledge to do it the right way. I told the woman today, if you want to go somewhere else, you can. But I'm going to also tell you that if somebody else takes this case and it goes sideways and you come back to me, I don't take those cases anymore. I don't know if Bill knows this or not, but if I treat and plan a case, they go somewhere else because they're not feeling it with me. They wanted to spend less money. They thought somebody else could do it faster, and it goes sideways. And they come back to me after I've seen them the first time, I don't take the case because it's too much aggravation. It's not a blank slate. It's not, a clean piece of canvas anymore. And it's very difficult to get the trust of the patient back and get back to a result that you think is clinically acceptable. So I just tell people that now. If you want to do it the right way, I don't know how long it's going to take me to get there, but we're going to get there. So that's what we do. We're very honest and forthright with people. And again, sometimes I think there have been a lot of dentists who have visited us, and they've been outside of the room and listened to the way that me and Ramsey speak to some patients. And afterwards we walk out and they're like, "Wow, I can't believe you really said that." I said, "Is there anything in that conversation that wasn't truthful? Did I lie to the patient?" They go, "No." "You just didn't candy coat it." I go, "You're right. We just don't do that anymore." And the truth is, I'm too far into my career. I don't have the kind of time that I used to have. When you get busier, you have less time. You have to be more efficient, which
Sure.
I talk to Bob Margis about all the time. We talk about numbers and we share our numbers, and I'm not embarrassed by my numbers. How can we be more efficient? How can we be more profitable, still put out a great product? We say this, it's very easy in dentistry to make a lot of money doing the wrong thing. It's very difficult in dentistry to make a lot of money doing the right thing.
Oh, it's a bold statement right there, but there's so much truth to it. Yeah, I don't even know how to, I'm speechless with that, but that's a great one, right?
But it's that, yeah. And then Bob steals my famous line. I know, Bill, you know, Bob has stolen this line from me that I'm about to take. So, and what Bob never tells you is the story that you get there. Guy comes into my office, patient sits down, he's got on his front 8 teeth, he's got the half moon semicircles of decay. There's really very little tooth structure left. He needs 8 restorations, full coverage on front teeth. He says, no, I just want you to put fillings in those teeth. I said, no, I'm sorry, that won't work, because by the time I get done taking all the tooth structure out of it, you have about that much tooth left. I can't hang all of that filling material, bonding, on your tooth. And the gentleman said to me, is, well, I'm usually pretty good at getting people to do what I want them to do. And I went, oh. So I turn around and I rip my gloves off and I threw them in the trash, and I get up out of my seat to walk out of the room. He goes, hey, where are you going, Doc? I said, we're done. He says, what do you mean we're done? I said, oh, I told you I can't do that. It's not going to happen here. And you just told me that you think you're going to get me to do something that's not going to happen. And I see my assistant in the back, and she's like, and she's laughing. And he goes, you won't do this? Why? And I said, just because you don't want to do the right thing doesn't mean I'm going to do the wrong thing.
Boom. What a line. And
then, of course, that got stolen many times over by my brother, Bob Margis.
Oh, I've stolen it too, by the way. So
I've heard it. You know, I've heard that several times. I didn't know that was the origin from you. But that's,
and now you know the clinical scenario from when it happened.
Making this campaign so that you're the one that's recognized with that, because that's a bold statement and a very truthful, powerful thing. So,
you know, and it took me a while. Don't think that I did that 2 years out of dental school. I didn't say that. I didn't do that. Did I have employees that I had with me that I would, right now, would they be my employees if it wasn't 2 years out of dental school? No, no. There are things we have to do, because it's a journey, that along the way you learn that you would not do. There's things I do now that I would never do back then, or vice versa, right? So, you know, you got to find your way. All I could tell you is stick to your guns. You find something that works for you, keep doing it. Don't change. I tell people with adhesives, if you've got an adhesive that works, why are you going to change the next best thing that comes out? It's working. Don't change it. If it's not working, the first thing you got to look at is an operator error. If you take the operator out of it, which is probably the problem 75% of the time, it could be a material, but Dennis Fassbinder has a great line I stole from him. Dennis has the line, we get paid to read the directions. So when we're lecturing about adhesives, about cements, I know, because I've read the directions on how long you have to scrub the adhesive and how you have to use your warm air dryer for 10 seconds, and you have to light cure it and make sure you have you're over your light aperture, you have some sort of a covering so that in case your assistant starts to doze off and they touch the tooth with it, you don't pick up a tooth booger on the end of a curing light, which then decreases the amount of energy coming out by 50%. These are all things along the way that can be prevented. At the same time, you have to know that this is the potential pitfalls of when you're doing this type of thing. So I always say, look at yourself first, get education, and then start blaming the materials of the lab before you start doing that, right?
That's so true. I think I could go back to the one thing you talked about with you and Chris talking about how 95% of dentists don't see things from a global level. And the only thing I would add to that is the fact that you actually jump in and do, which I think 95% of dentists learn this material, but they don't take action on it either. And I would imagine that you probably learned a lot of valuable things from many years and many mistakes along the way, and just kind of figuring out your process and your way, right? So now you see things differently than you would have. If you saw that case 10 years ago with the education you have, it might have been differently, but you know, a lot of those 95% won't get that.
That's a great statement. I'm going to wrap it up into one small story. So early in my career, I was doing tons of porcelain veneers. As I learned them from David Hornberg when we were teaching PAC Live. The one thing that was not working for me at times was I was noticing at the beginning of my career, I was getting chipping on my lateral incisors.
Okay.
Now, when this was happening, because back then I had not taken, at this point, this is right before I started Spear, before I started Kois. And I didn't understand envelope of function. When you said envelope of function to me, Posselt's diagram that I learned in dental school on that quiz, A, B, C, D, E, I didn't know what the hell that thing meant.
Sure.
All I knew was point A where B, you'd label it on the exam. That's all I knew. I didn't realize that when you're starting to lengthen teeth and you have to take into account chewing stroke from the outside in, chewing and speaking, that you could get up on those teeth and break them. So what happened was I would start asking questions. Why are the laterals starting to break? And the answers I were getting were the most ridiculously stupid and uninformed answers I could get from people. Answers like, well, I think it's because of the difference of the coefficient of thermal expansion of the pressed porcelain versus the felspathic on the edge. I think it's your third generation adhesive. You should be, or your fifth generation adhesive. You should be using fourth generation adhesive. I said, wait a minute, I'm not talking about the veneer popping off. I'm talking about the distal incisal edge breaking. How does the adhesive have anything to do with that? And so I finally got to the point where I said, okay, I'm not getting the answers I'm looking for. Who can help me here? And so that's when I started taking Frank Spear's courses, which then led into the Kois Center. And then I realized, oh, the envelope of function. So I'm increasing the length of the teeth. If I just put the teeth straight down, the way they're chewing and speaking is they're hitting those incisal edges. No wonder they're breaking. I have to either flare the upper teeth out, pull the lower teeth back in, get rid of the areas of friction that's causing that so I can't get up on the porcelain to break it. Okay, all of a sudden, those problems disappeared. They disappeared like a fart in a hurricane. They're just gone. We have hurricanes here, so I got to mention that. So all of a sudden, the remakes went down to negligible. But those were not the answers I was getting initially. So what did I have to do? I had to seek out people who had the answers because the other people in the other places didn't have good answers for me. That's what happened.
Sure. I mean, you got to live it. But also, like we talked about prior to the start of this, is I think when your mind is open towards certain messages, that's when the answers come, right? And you can be very closed off, just like the dials that we talked about with your insurance at your office. You know, my mind was closed to that when I first heard that, but looking at that now, it's very different. It's the same with your lateral discussion. It makes so much sense to see this and then become aware of this once you start having an open mindset towards that.
When I graduated dental school, I went with the mindset of, this is my opportunity to start learning. That piece of paper, all it did was tell me I can become an eternal student. That's what I am. I'm a perpetual eternal student until the day I retire. And I'll still probably come to the meetings just because I want to see my friends, right? And see all new innovations that are happening in dentistry, even if I'm not chairside dentist. What's amazing is I've run into a few of my classmates from dental school. They haven't done much since.
Right.
Which is kind of weird to me because it means they're practicing like they did in 1993. Not exactly where I want to be, but that's their own personal journey. To me, it's an open, it's an open book. I just want to continue to learn. And when I see something new that can work, I'll implement it. I don't change for change's sake. I change if things make it better and easier and faster, more reproducible, which leads to profitability, which was my last thing I want to talk about, which is, digital dentistry. Well, I've done this once or twice. I started out with digital dentistry. I had an original Lava COS machine. I probably got that scanner. It's got to be now 14 years ago. And since then, I think I've had 8 different scanners in my practice, and right now I've got 5. Right? Excuse me. And you know who's FaceTiming me? Bob Margis.
Get him out of here.
Bob Margis just FaceTimed me. Back to the scanner. To me, scanners have changed the way that I practice because I'm not going to tell you I'm 100% digital scanning, but I'm 99%. I scan almost everything. New patient comes in and I'm working up a case, they get a digital scan. They come in a hygiene, first appointment, they get a digital scan. When we start a case, digital scan. When I'm doing a single unit implant restoration, digital scan on the scan body. 10 unit veneer case, digital scan. Everything is scanned because I'm tired of using impression material, taking the perfect impression and realizing one of the 10 units is not perfect. And you have to go back and take it again. And you take it again. And you take it again. And you take it again. And it's just too frustrating for me. Not when we've got technology that is better than an impression. And this is the tough thing for a lot of dentists. It's just an ego thing when you think about it. They struggle with that. They struggle with the fact that the technology is better than they are. Meaning, I'll go to places and you go around the room and this person over here thinks they prep better than that person, that thinks they prep better than that person, and that person thinks they take a better impression and it's a better quality impression. The truth is that you take a digital scan, it's better than anybody's impression, and all the data now will show you that. Now, I'm not going to be, let's be very clear. I'm not talking about taking edentulous for complete dentures, although that is done now. And I think they still struggle a little bit with cross arch when they're doing bars for hybrids. I think they're getting better at it, but quite honestly, I don't really do that much of that. I really, really don't. I'm not the hybrid, extract everything teeth in a day guy. That's not what I do. I do maybe 2 cases that a year. I don't turn it away. I just don't market myself that way. And the truth is I don't enjoy it as much. So I don't do that. But for the single unit quadrant, full arch cases of fixed, everything is scanned. And because of that, I don't get the call that the impression didn't come out right. I don't get the call that the box didn't show up with everything, that the model broke. I call that the 50-pound bag of bricks. I left that behind a long time ago, and I'm not going backwards. I'm only going forwards. Now the problem has been, the lag is not the chairside intraoral scanner. The problem up until about 2 years ago was the quality of the digital print of the printer that the laboratories were using, which then turns into a very uncomfortable situation that you have with your laboratory. So then you have to start asking your laboratory really different questions that you would years ago. What digital printer are you using? Because if you're using a Formlabs printer for my 10-unit veneer case, I can't send the case to you. The quality of the print is not commensurate with the quality of the scan. So then my laboratory, what I would do is I would either only use the iTero models, which are milled models, excellent quality models, or my laboratories acquired the carbon printers, which allowed them to get a quality print to make removable dies. Up until then, we couldn't do this. So it was a real transition for my laboratories as well as me. So if they didn't have a carbon printer, and now they've got there's a couple of other printers that you can use as well, like a NextDent printer, that the quality of those prints for single unit dies is excellent. But if you're using a Formlabs printer to do this, I'm not sending you the case.
Sure. So for someone like me who just got a scanner today, what would be your advice towards avoiding some of the pitfalls of initiating the transition to digital?
Well, first, right off the bat, everybody's got to get comfortable using it in your practice, yourself, your clinical assistant, and your hygienist. Because I believe that when they come in, I don't know how the practice flow is for you, but when a patient wants to come in and get their teeth cleaned, all the records are taken by my hygienist. They take the charting, they do the intraoral camera pictures, they take the digital x-rays, and they take a digital scan, which then goes into their Dentrix file by thumbnails. And so everybody has to be able to do that. The next thing is, are you working with a laboratory that is digitally adept? Sure. Meaning, are they working with 3Shape or exocad, number one? Are they sending those designs out, or are they doing it internally? What kind of printer do they have? Do they have a NextDent or a carbon printer? And then are they able to do model-less crowns for you? Because if they can do those 3 things, you're good to go. If they can't, I'm going to tell you it's an uncomfortable thing, but you're probably going to have to work with a different laboratory to get the quality that you're looking for. What you don't want to be is a guinea pig for these laboratories, because that's wasted chair time when it comes back and the contact is open. And when you're doing a monolithic restoration, whether it be lithium disilicate or zirconia, you don't want to have to go back in your porcelain oven to add feldspathic porcelain to close a contact. That defeats the whole purpose of monolithic restorations. Mm-hmm. So you got to work with somebody who knows how to dial in the parameters, so when the restorations come back, they just drop in, like what Bill saw that day. That's very, very important. Very important.
It says a lot too, in terms of just the workflow and trying to change everything. But I think at some point in time, Darren Becker, I don't know if you know Darren, but he said, January 1st, you're going digital 100%. That should be your goal. And I think that's a lofty thing, but I think it's important too. but I think it can be done. It's just a matter of implementing it and doing it over and over and over again.
It is, and it can be done, and it is done because there are people that do it. All I try to tell people is there are going to be pitfalls along the way, right? And you don't throw in the towel because the first case or two didn't go. But if you're going to be using this for laboratory restorations, you're not going to mill chairside. I'm not going to talk about that because I don't do that. Then you've got to work with a laboratory that's been doing it for a while, because otherwise you're going to get into a problem, and it's going to make it an uncomfortable day for you, your relationship with your patient, and then your relationship with your ceramist.
Mm-hmm. No doubt about that. So I think a common question we get all the time would be in terms of packing cord or doing Traxident or whatever it is there a system that you have in terms of getting single unit crowns scanned?
Oh yeah, I mean, nothing has changed from analog. So what I learned from Bill Strupp is what I do today. It's a single unit double zero cord soaked in hemodent. If there's tissue tags, I have a I have a diode laser that will move over a tissue tag, a flap that flaps over the preparation. But otherwise, it is prepped, equigingivally with one double zero cord that is pulled before the scan. That's it. And that's the way I've been doing it for 25 years. 25 years. I don't do that. I will stick with that because it works. And I don't, that's the other thing now. I don't argue with anybody. There's no arguing. I never really mix it up on any social forums because the fact is everybody's an expert on those.
All right.
All you have to do is put one nice, John Sorensen had a great line. We looked at a case one time and he goes, everybody always puts the picture up the first day those veneers go in because that's the best day that porcelain's ever going to see.
True.
Right?
Sure.
Which is true, right? So if you notice my Instagram feed, I show cases that are 20 years old because I don't want to be the smile design of the day club, because anybody can show you something that's beautiful the day of, a week later when the post-op pictures are taken. Doesn't impress me. Show me the case 7 years, 10 years, 15 years, 20 years later. Yeah, there could be some recession, but are the restorations still in place? Are there any fractures, any chipping? If not, that means everything that you did to set the case up correctly was the right way to do it. And so all those techniques of doing analog, I still use. So thank you, Bill Strupp. I had to do it today. I had to cut off some restorations from somebody that did some local restorations. I cut them off and the teeth were mutilated underneath. What did I do? I used Bill Strupp's foundational core technique, which is his holy triad. And I built up those teeth and re-prepped them and just put them in provisional, sent them out to the periodontist. I did not attempt an impression today. It's part of a bigger case, but it needs crown lengthening, osseous recontouring that Bill Robbins teaches so well. I don't do that. I mean, it's fun to watch. You have to be very talented and skilled to do it. I don't like blood. You should see me. When I'm under a rubber dam, I see a little bit of blood. I'm flailing around. Give me the hemodent. Give me this. I don't want to see blood when I'm working, right? I just don't enjoy it. It's not my thing. But I recognize very clearly that this dentist had violated the biological width, and the tissue looked like hamburger meat, and the patient needs more intensive work. The patient needs, in the anterior, needs osseous recontouring, and in the posterior actually needs gingival grafts before we can move forward on the case. So I provisionalized him and sent him on his way, and I said, I'll see you in 4 months, because that's the other thing. There's no rush for me. When they do foundational crown lengthening for me, I don't even touch the patient for 4 months. And I always get a nice call from the periodontists who do it for me. And they're like, Ritter, you're the only guy in town that doesn't call us, hey, when's the patient ready to go?
Says a lot. Another thing about your practice though, too, is that you do what you love to do. And I think a lot of people get out of school and they're doing endo, implant placement, cosmetics, you name it. Like you said, experts of everything. You can't, but you found what your passion is and you found what you enjoy, and then you go forward with that, and that your day is far more exciting and entertaining because you're doing what you want to do as opposed to the things that you don't.
So let's break that down. Why do you think young dentists do that? Because to me, there's only one reason why.
I would imagine because they don't know what they like at that point.
Yeah, they're probably still trying to figure it out, right? They're still figuring out what they like and what they want to do versus what they're doing.
They also don't really have enough patience to do any work at that point in time when they first come into practice.
They probably have a lot of time on their hands, so they can sit there and
financially.
And then ultimately, financially, I need to pay some bills. Okay. So as you go along that path, you realize you're practicing a year or two, you can look back over a year or two and say, you know what? I don't really like doing endo. It's like picking a lock in the dark. I
Sure.
don't really want to do it. The endodontist down the street is really good and he wants my business and maybe he'll send me some patients back if I refer the endo to him. So all of a sudden, first thing you do is you get rid of your endo, right? And then you either start taking courses on perio, because I will say, in my career, if there's one adjunct that I kind of look back on that I wish I would have learned and taken a Bill Robbins course one more time, taken a course from Pat Allen on gingival grafting, taking a course from a hands-on course from like a Dennis Tarnow of implant placement, I think that would have impacted me in a very positive way. The downside is that I think I'm very meticulous about what I do. And I don't know if I would have been able to, I think I would have beat myself up a little bit. I think I would have tried for the perfect implant placement with the perfect connective tissue graft, with the perfect recontouring of, I don't think I would have gotten very fast at it. And I think it would have taken me a long time, whatever procedure it was, because of the meticulous nature of what I do. That's how I kind of justify it right now, how I didn't do it. What I'm going to say though is that if I was a young dentist, I would definitely look into those adjuncts into your practice, because right now, for you to able, let's say you had an iTero, you could easily add Invisalign to your practice, right? And it's tailor-made for that. So all of a sudden you've got an orthodontic component that you have some control over, but it's also, you know, machine learning of how to move the teeth. So that you can add, and then I would take courses on crown lengthening. I would take courses on extraction implant bone grafting, and then of course, connective tissue grafting from somebody like to meet. I watched Pat Allen work, and this man is so, what he was doing was so fast and so clinically excellent. I sat back watching him and I said, even if I started to do this, let's say this was 5 years ago, I still, in 5 years' time, wouldn't get nearly as good as him. And so I said, well, if that's the case, why am I even going to try? Let me just send to my periodontist who's really adept at it, and then they'll set me up for success. Because that's what I tell the patient, right? I'm going to send you to the best patient, the best dentist who's going to set you up for success. Send you the best orthodontist, the best periodontist, the best oral surgeon. And so when you come back to me, I got you. I work from the gum up. They work from the gum down. And the patients seem to get that.
No, I totally understand that. Let's talk about your one case you posted on Instagram. You know, I thought that was quite a remarkable thing, because you took this case and then you went through the digital workflow of things, and it ended up being, you know, such a remarkable case at the
Yeah,
end.
I don't know if Bill saw that or not, but did you see that case, Bill? Did you see it?
I didn't see it. No, I didn't see it.
So, okay, it's on my Instagram feed. And so what I did was, I'll hold this there for a second. Patient comes to see me, had seen another dentist in town for an opinion. Of course, the second opinion always gets the case, right, Bill?
Yeah.
It always works that way. And the patient was told they need veneers, but the way her bite was set up, you couldn't really lengthen her teeth without opening the vertical on the case. You just couldn't do it. And so what happened was we wound up having an implant placed in area of number 5. And then we came back and we opened up her vertical. In this case, I used the Coisty programmer to open up the vertical. I caught her on the hinge. She had 2 normal joints, so I was able to capture her in what we call centric relation, right? And then I took the scan and I sent it to the laboratory, and then working through our digital protocol, which is we share a screen, and then he starts manipulating an exocad, or he does it in 3Shape, and he designs the teeth, sends me back a printed model, and then I went ahead and prepped the teeth and I fabricated the provisionals. I make the Bistacryls the first set. But my protocol is a week later, I bring the patient back after the initial scan of the prepared teeth, and my laboratory makes me 2 different restorations, one on 8 and one on number 9. And they're made out of 2 different either materials or 2 different shades. And then I put them in the mouth and let the patient pick the shade. And they usually go with the lighter shade, which is okay. But then at the same time, what my laboratory has done is they've milled PMMAs off of my prep with the overlying smile design. So then all I got to do is slide those temporaries back in, which is what I have here. And then I scan the provisionals in the mouth, and then they go to final. And it becomes a very predictable workflow for me. In a sense, I'm making 2 sets of provisionals, but the second set really is the set that I'm able to dial in and make any changes, changing the buccal corridors, making the cusp tips rounder, or opening up the embrasures or closing the embrasures, changing the line angles. We scan that. Now my laboratory has the pre-op scan, they have the scan of the preparations, they have the scan of the pre-approved provisionals. It's simple for them to move forward with whatever restorative material we pick, whether that be zirconia, we use lithium disilicate. It becomes, this is the way we do it every single time. And because the laboratory is locked into that, whether it be Bobby Williams at Synergy or Nelson Rigo, it becomes very, very predictable. And when it becomes predictable, it becomes fun. It becomes profitable.
I would imagine it's nice having the ability to make changes off of your first set. You know, just there's so many things you can look at after a case that you've temporized and you just say, this doesn't look all that good, but then you can communicate that and they can come back in a digital form. And then also the gum tissue's got to be a lot healthier coming back from that, because now you have the perfected margins around that.
This is something that nobody really talks about. When the second set of provisionals, which come from the laboratory or PMMAs, they fit knife-like margins to your preparation because it's based on your preparation. So while they're in the provisional phase for the other 3 to 4 weeks while the final restorations are coming together, when that patient comes back and you remove those provisionals, the gum tissue is 100%, it's perfect. It's perfect. The day of cementation, it's perfect.
And that's so much better when you can have a day that you cement and it's good gum tissue versus poor gum tissue. Ask me how I know, because it doesn't work out well if you have bad gum tissue.
Because it goes from a situation of being a very tough, stressful day to being really what it should be, which is a day to celebrate when they go in and the patient looks at themselves in the video and says, oh my gosh, that is 100 times better than I thought they were going to be. And that's the joy in it, right? Which we all practice for. Practice for profit, but we practice for joy. We practice because we want to help the patient. We enjoy what we do. I mean, I believe the people who are doing it at this level, you're doing it because you really, really enjoy doing it. And if there's no joy in it, you shouldn't do it in the first place, right? And that goes for any walk of life. I understand having to make a living, but you got to find what you really love to do. Because what's the line? You find something you love to do, you never work a day in your life, right? It becomes a hobby.
Oh yeah, of course. So my other question would be, if you had veneer preps, you know, you're probably spot etching and bonding them on with the bisacryl, and then you're taking them off and then doing the same process with the PMMAs as well.
Right. So what you do there is on the veneer preps, I probably would not make PMMAs. What I would do is what I've done before is you section out 8 and 9, you pop the 2 provisionals off, you try the 2 veneers in, and then you just spot tack them, bond them back to place. That's what I do.
Gotcha. Okay.
It goes out of PMMAs. So those are only for full crowns and when we're opening the vertical dimension, right? And we're changing that dimension.
Okay. Yeah, that clarifies a lot. So this answers a lot of my questions there. So we just had some comments about not a whole lot, but I think it's just ultimately I've enjoyed this discussion. Now, I think I want to wrap this up in a sense of, what does the future look like for you specifically?
What's that? What do you mean?
What does your future look like? I know I like asking that to people. Like, where does your future look like the next 5, 10 years from now? What are you going to be doing?
Well, I can tell you short term, me and my business partner are going to do an office rehab. So we're going to redo, because our office is 16 years old now. So we literally started last week. We have a designer that came in, and we're going to be, we're going to have a different feel to the practice, and we're going to redo it. Not going to be easy, but anything that's worthwhile. I just
went through it. It's awful.
Yeah, it is awful. I mean, there's no way around it. But it has to be done. The office is 16 years old because I still want to practice. I want to practice another 10 years. So you're asking me long term. Long term, I enjoy what I do. Now, I work 3 days a week now, and I love working 3 days a week, and I don't really want to go back to 4 or 5. Short term, I want to hire an associate or two. I mean, my business partner doesn't want to work more than 3 days a week either. And then long term, my daughter says she might want to become a dentist. Now, that's the voice of a 16-year-old girl. So you don't really know. So if she says to me when she gets into college in 2 years, you know, Daddy, I really do want to go to dental, then I'll continue to practice until she graduates so she can come in with me. If she doesn't, you know, I really believe that I don't see myself selling the practice, but I see myself staying on more in a mentorship, guidance role in the practice, maybe doing less clinical. But I would like to practice another 10 years and then see where I'm at. You know, 10 years from now, it'll be interesting. My daughter was either going to be out of some sort of school and on her own, or, you know, or she's in my office. So we'll see where that's at in 10 years. And then I'll still be a young man 10 years from now. And as long as I have my health, both from COVID, and I know we didn't really talk about this, but ergonomics, I've had 2 neck surgeries.
Really?
Yeah, I've had
From
2
dentistry
neck
or from something else?
Well, it's a combination, 90% dentistry and 10% heavy lifting. About 10 years ago, I got into I really got into bodybuilding, believe it or not. And I got myself, it was kind of an experiment, which was kind of fun, but it really screwed up my neck doing deadlifts and doing squats. And you put that together with poor ergonomics in my practice, and I wound up herniating my discs.
Jeez.
And so you need to watch yourself. You really need to be careful because you can hurt yourself. And I know a lot of dentists that go out on disability because of it. I didn't want to do that. So I try to keep myself in really good shape. And I would tell everybody, watch your ergonomics, maybe even transition over to a microscope eventually. And continue to practice the way that you want to practice because it's a fun ride. I really, you know, it's been good. It's been a really good career for me. I've had a low moment or two in my life in dentistry. And I've also had some of the greatest moments in my life, like when I became a member of the Restorative Academy. I mean, that was absolutely gut-wrenching for me. And so it's like anything else. You put yourself out there. What's your goal? What do you want to be? And just make it happen and don't let anybody stop you. I'm a big proponent of, if you don't want to do it, don't do it. But don't let anybody tell you you shouldn't do it. Go do it. That means getting education, becoming a better dentist, go do it. Don't let somebody tell you, oh, you can't do that. Wrong answer. Sure. I appreciate your time tonight. It was a lot of fun. We had some questions over here, but I think we're going to run out of time, aren't we?
Yeah, I think so. You know, I think it's something that I've enjoyed just listening to you. You've dropped so many, you know, one-liners that I literally put quotes in my phone and wake up to it every morning. So I think you're going to have several in my book now, but it's just something that I genuinely appreciate the time that you've given. And I think this is something that I've taken so much away from this, and I'm sure people have too. But you did this to me 3 years ago, man. And I am so grateful for that because you paid that way. And I'm continuing to keep going down the path that you've led. And I think it's important because that's how we get by. And I hope one day that I can keep passing that torch along too, which is important. So I don't know.
You will.
There were a couple of places in the chat that need to be acknowledged here. Jody Case said, hey, good to see you. Brandon James came on and said, can I come down and work with the Men in Black? He also told me I wasn't man enough to get on Instagram by myself. I needed one of my grandkids here. So I held up your case to show Brandon that I could find it on Instagram. As always, Rob, it's just great being with you. I wish we could be together now for a drink afterwards. That's how we usually finish the day. We go out for dinner and to the bar. So we can't do that tonight.
Bill. It's an odd time. I really hope that look, I hate to say it, but the rest of 2020 is just going to be, we just got to survive it.
Mm-hmm.
Yeah. But I'm hoping that 2021 will get back to a new life, that we do have the Restorative Academy at the end of February, and that we can have that drink up at the bar afterwards, because those are the best times. I mean, that is absolutely, to me,
sure.
The education's great, but the camaraderie, the jokes, the warmth, the friendship, the knowledge, the longevity, it's what it's all about for me.
That's great. You know, and personally, I've made so many friends through this channel, and it's something that I've never. I didn't know Bill's height. We used to have that photo to me the other day, and it was just like, God, I didn't know you were. I don't know how tall you are. So it's just what it comes to, but it's too funny. But I think it's the best thing about the dental community is the fact that it's the camaraderie within people, and I think there's no profession that's out there that's better than that. I am really thankful for your time.
Well, my pleasure. And you're doing a great job. You keep doing what you're doing, man. I think I got to tell you, I love success stories and I love people, because it's weird for me, man. I mean, I've been doing this now, starting my 26th year, and I remember being you. A lot of people are like, oh, I don't remember that. Bullshit. I remember everything. I remember
Sure.
being 3 years out of dental school. I couldn't take it in enough. I couldn't meet enough people. I
Same.
couldn't put myself out there enough. I was already starting to lecture. I was already lecturing. Um, I wanted to be that guy. So I know what it's like for you. The world is so big. It's exciting. It's new. And I'm glad to see you're doing it. I really, really am. And just keep doing the right thing and picking up. You're already in great company. You know, you can judge people by who their friends are, right? And you're already in terrific company with great mentors who's going to lead you along the way, and you're going to have a great career.
That's profound
Rob,
words.
Rob, you need to hear what Dr. Brar just wrote to make it clear that your evening was meaningful. He says, thanks so much for sharing. I have bulge disc L5S1 going through my low moment in dentistry and a hard time in life. Sometimes feel like I got in the puddle even before takeoff. I'm a recent dentist, but it's inspiring to hear and connect with dentists like you. Thank you. So, you know, what you've done tonight makes a difference. Thanks, my friend.
It certainly
Well,
has.
thank you. Thank you.
And good luck to you, Dr. Brar.
How can people contact you? I follow you on Instagram and I love everything you post. I think if you could share that.
Instagram me. It's simple as Dr. Rob Ritter and then DM me, right? I always get back to people on Instagram. That's the easiest way for me these days. And it's been a great way to connect with people too, sharing information on Instagram. So it was just great. Thank you so much for having me. It means
a
to
lot.
me, yeah, look at that. The hour flew by. Remember we said it's going to go quick. It always goes so quick. I could stay on for another hour, but you know, I get
time.
it.
So we got to get into bed.
I'll be back. Anytime you need me to do something, you let me know.
I appreciate it. You know, it's just something that truly getting friended by you was just something so surreal to me that, I mean, it's better than LeBron James friending me. And I mean that in a wholeheartedly, you know, every way, because LeBron means nothing, you meant a lot to my career. So
Kevin said, it's me connecting with him was better than getting one from.
But I mean that. Like LeBron means nothing to me, truly, but you've had such an impact on my practice and my hygienist, my wife, my family, whatever it might be. So next week, I'm excited. We're going to actually kind of combine the master class with Bo Bruce in terms of taking that and picking out that 2-hour lecture and coming from a new dentist perspective. So it'll be fun. I'm looking forward to that. It's something that I don't know him, but I'm looking forward to meeting him just like I got to get to know Rob today.
Okay, I'm going to tell you one more thing about Bo.
Sure.
Okay. Because Bill knows him very well. You know, Bo went to the same dental school as me. When I was a senior, I think Bo was a freshman. And I didn't know him, right? Quite honestly, I just didn't know anybody underneath me. I was just trying to finish my requirements to get out of there. So I started practicing. And then I remember I told you about 3 years out, I started lecturing. Well, Bo, I think, was in his first year of being in private practice. And I gave a lecture up in Asheville, North Carolina.
Sure.
And this guy comes up to me at the end of the day and he says, "Hey, man." I said, "Hey." He goes, "My name is Bo Bruce. I went to dental school with you." And I said, "Okay." I said, "Okay, I believe you. I'm sorry, I don't know." He goes, "I want to do what you do." I said, "What do you mean?" He goes, "I want to lecture. I want to do this type of dentistry." I said, "Okay, give me your number." And so I don't want to say, I mean, I don't want to, come out and say I was his mentor, but I think I gave Bo some good information. I put him in touch with some good people and I got him started, forget me, on the path, because I was told by somebody that helped me to get started that people are going to come up to you and they're going to ask you to help them. I'm like, "Oh, that's not going to happen, please." And he goes, "No, wait and see. Wait and see." And of course, literally 6 months later, Bo was the first. And I don't take it lightly. And whenever somebody comes up to me, I make it an absolute point to point them in the right direction, get them hooked up with the right people, and give them good advice on their journey, because you need somebody along the way. You do. You need help, not detractors.
I think we're gonna end on that note. That's a big one. So truly, Rob, I can't wait to have you back here. We'll talk about a different topic or something, but this is gonna be a fun journey. You know, I can't wait to meet you, Bill. I can't wait to meet you too, but it's just something that it's gonna happen hopefully at some point in time in 2021. And
It will.
all the best to you, man. Again, please, you know, anything you need, let me know, you know, and I think we'll just sign off on that, and hope you guys have a good night.
Okay, have a great night. Okay, amigo. All the best,
Rob.
okay?
See you, my friend.
Thanks,
You
guys.
too, brother.
See you
Love you,
later.
man.
Thank
Later.
you.
Too.
Bye-bye.